Good afternoon, and I just want to thank Dr. Abrams for that wonderful talk, and acknowledge it's kind of hard to go after that. I wanted to welcome the alumni back today. If you're scratching your head trying to remember if I was that guy that taught you biostats or something, I didn't. So if you have a negative feeling towards me, it's something else. You saw it on YouTube or something. I'm Ryan. I'm a new professor here. I work in HPS, and I need to use this one. Okay. So my talk this afternoon, I'm gonna talk about sort of the toolkit that we have as public health professionals to look at regulatory options. What sort of policy strategies or approaches can we take when we're thinking about e-cigarettes? In particular, with the complex system that Dr. Abrams described. I love that metaphor of threading a moving needle. Made me think of Star Trek, sort of. I don't know why, because time is moving. And we have a lot of public health challenges. I went recently to Manila to the Western Pacific Regional Office for the WHO, and we had meetings to try and help come up with the position statement around e-cigarettes. And one of our colleagues in tobacco control, Simon Chapman, said that he's been working in this field for 30 years, and this is by far what he considered the most challenging and complicated and complex problem to really work through, because we're dealing with so many moving parts just in a public health context, let alone an industry that's changing and changing so rapidly. So I, as a researcher, I'm interested in tobacco control policies. They're a lot around smoke-free and tobacco-free spaces. I've worked on the development of policy, implementation, and evaluation. And I think it's interesting when we talk about some of the policy options. The discourse in the media, what we've been talking about largely is sort of how e-cigarettes are related to cessation and how efficacious they are and how safe they are. And of course, there's all these other sort of policy dimensions that we're interested in looking at as well. And then I'm going to go through some of those today, as well as what some countries around the world and some jurisdictions have tried to do and what they have implemented. I just wanted to start with this image. And it was interesting, Bob, when you were asking your question, you said initially smoking e-cigarettes, and then you switched to vaping, which is a very sort of intentional. So I was trying to find images for this presentation, and I looked on iStock, which is a very common and popular image website that you can visit and purchase, not steal images. Sure. Okay, so if you do a search on iStock, you find hundreds of images that you can purchase of people using e-cigarettes. And they're young, and they're older, and they're men and women. And I was looking for signs like this, sort of that suggested that you could not use e-cigarettes. I wanted an image that said, e-cigarettes are not permitted here. And there wasn't a single image that you could find on iStock that said no use. But there were several that looked like this, that said vaping is permitted. So I just thought that was curious. It didn't take too long to find a sign that did, but look, this is, again, it's a no smoking sign. It's not a no vaping sign. And it took me a while to notice, but if you look closely, sort of, and this is in the context of how we're going to start to communicate some of these regulatory options that we have. How are we going to consider how we're framing these issues? The first line there behind the red slash is clearly a cigarette. There's smoke coming off of it. If you look closely, can anyone notice? Yeah, the E. It's an E. It took me a while to notice that, but it's brilliant. So the people in Hawaii are very good at this. I hope this is not stealing too much from my colleague Kate Smith. I know she's going to talk a little bit more about this framing, but I wanted to highlight in the context of what we're trying to accomplish in terms of making some of these decisions around how we're going to regulate the product broadly. I'm going to share some sort of insights and recommendations, some position statements that have been developed from the public health NGO community, the NGOs that sort of have a global perspective, some research that's sort of led to some conclusions from the public health research community, and then I'm going to look specifically at some regions and country policies that have been adopted. So again, the Tobacco Control Legal Consortium, they have produced a briefer on regulatory options. And again, this is from a US construct, but it's applicable internationally. And they, of course, sort of present these regulatory options that look very similar to what we've been using in the tobacco control community to establish and try and address some of these systems issues that are apparent. There's a long list of public health organizations and NGOs that support regulation of ENDS, electronic nicotine delivery systems, or e-cigarettes. And a lot of the industry, the e-cigarette industry, is asking for regulation as well. I just wanted to sort of go through some of what could be done. So sales can be regulated, obviously. A government can prohibit or limit the sale of ENDS within their jurisdiction, meaning who is permitted to sell them. Jurisdictions could require licensing fees to be paid. There could be permitting systems for these products similar to what we have for tobacco. Further, we could limit it to only allowing sales in venues where only adults are permitted, similar to alcohol in some contexts. We could certainly do a better job of limiting the age where people are allowed to purchase e-cigarettes. There's a lot of stories, if you search the media, about parents finding their 11-year-old has come home and bought blueberry e-cigarettes, and they'll try to return it, and the salespeople say, it's got no nicotine, I'm not going to take it back. It's just like a toy. We, of course, could ban sort of specific avenues and venues for sales. FDI talked about banning sales in vending machines. I've never seen an e-cigarette sold in a vending machine anywhere. Has anyone? Have you? Where was it? In the Las Vegas airport. Well, you should probably leave that there. What happens in Vegas? So, how much was it? Do you remember? Oh, yeah, Vegas, they always want your credit card. Just start a tab, ma'am. That's interesting. I guess it's a bit gauche to put the prices on everything, right? So we can, again, regulating the marketing and advertising environments is something that jurisdictions certainly can do. I was driving on the I-95 the other day behind a truck that was covered in images of e-cigarettes that looked exactly like cigarettes. And it said, tobacco flavor, like it's an ice cream or something. It brought me back to, it just did not sit right, but it's currently we're in this gray area, or it's completely allowed because it's not a cigarette. Governments, of course, are in the position to protect consumers from misleading or inaccurate statements and claims, so that sort of area can be regulated. Cessation claims, safety claims. I'm waiting for someone to come up with an organic and fair trade e-cigarette. I don't think we have that yet, so if there's investment opportunities, let me know. Professor Abrams talked about tax and price, and obviously the opportunity to think of things holistically in terms of raising taxes for different nicotine products as to change or alter the marketplace. Setting minimum pricing is another standard sort of strategy that those of us in tobacco control are interested in. One of the mechanisms I'm really interested from e-cigarettes is especially with the disposable products, we've got all these products that have batteries and they're e-waste. And we could certainly require deposits, for example, and we could require people to be recycling that to keep some of the earlier models. I think the newer ones more have ceramic heating, but I don't know the use of heavy metals and things like that. We should not be putting those things in our landfills, and we can use some of these regulatory strategies to address and solve those problems. Deposits really work. Regulating use, like where a person can and should be permitted to use an ENDS product. We've talked about, and again, the issues of exposure to secondhand vapor, the concerns about whether or not that should take place in a place of work or a public place, especially sort of issues that get pretty muddy in terms of outdoor spaces. If you don't allow smoking in parks like New York City, should you allow e-cigarettes? With their new legislation, that is, you cannot. They've added e-cigarettes along with that. We've talked about, and sort of Bob raised the issue about normalization and renormalization and how seeing this behavior goes on, it occurs to me too, we would be able in theory to regulate what the vapor looks like too, and we could require the industry to make the vapor look different. And if people are then seeing e-cigarette use in outdoor spaces, it could be clear that they're not smoking a cigarette. We've heard stories about people that are at a concert and they take out an e-cigarette and everyone gets really upset because they think, oh no, they're going to smoke, and they'll put the blue light to their cheek and say, oh, it's an e-cigarette, it's fine, it's all, and what can and should we be doing in terms of our regulatory approach to sort of mitigate and push things in the direction that we want? And along those lines of product regulation, there's certainly concerns. The European Union, I'm going to talk more about that later, but that we can be regulating sort of the safety dimensions of these products. Early electronic cigarettes, there were accounts of them blowing up. That was one of the reasons that airplanes, banned them and their use. Although I think you can buy e-cigarettes on Ryanair and other airlines in Europe right now, which is very similar to what the cigarette industry did, of course, decades ago. There's safety designs in terms of the solutions, making things child-proof. There's a lot of discussion, too, about sort of regulating the product in terms of the concentration of nicotine that goes into the solution. Do we want to make it such that the nicotine is high enough that it deters early initiation? Are there concerns about if it's too low, of course, consumers will not find the product satisfying, and then we don't see necessarily the gains we could see from a product that is accomplishing what it could do in terms of getting people off combustibles. Some of those issues are difficult because obviously, similar to a cigarette, users can titrate, they can alter their behavior, how they're using a product to, if it's set high, you can just essentially smoke it or vape it, whichever verb you prefer, to lower or increase the amount of nicotine you're getting. It's of course a bit counterintuitive because the current versions of e-cigarettes, with a cigarette, if you puff hard, you get more nicotine, but with an e-cigarette, if you puff hard, you're getting less because it's passing over the element quicker and it's volatiling less, so people have to adapt and learn sort of different topographies with how they're smoking. So what are we thinking in terms of some of the regulatory recommendations? So this is a report that was out last December from people at UCSF. Rachel Grana was the lead author, Neil Benowitz, Stan Glantz, and this was written to help support the World Health Organization and some of the development of positioning and recommendations. And the report it's comprehensive, but it does include specific regulatory suggestions. And what it puts forward is that first and foremost, we should prohibit the use of e-cigarettes anywhere where the use of conventional cigarettes is currently prohibited. That's one of the things that they put forward. The same sort of marketing restrictions should also apply. There's concern about characterizing flavors. I mean, like blueberry, bubble gum, who is that for? Katherine Hagel, maybe. Further, the recommendations, they want to prohibit claims around how effective these products are, of course, until we have more convincing scientific evidence. I don't know when we're going to agree that it's convincing, when we're going to hit that threshold of it. But I think the final recommendation was to regulate e-cigarette standards, again, around that, sort of those dimensions of safety to ensure that products are going to minimize risk to bystanders. Okay, so the Framework Convention Alliance, one of the things that's interesting about tobacco control as an area of public health is that we have the world's first negotiated and ratified global treaty on tobacco control. The Framework Convention Alliance, the Framework Convention, FCTC, Framework Convention on Tobacco Control, sort of sets guidelines internationally for all the nation states, all the parties to the convention on what is required at a nation's level in terms of the policies they need to enact, and there's guidelines in terms of how to roll them out. So the issue of e-cigarettes was discussed at the 4th conference of the parties in 2010, and it was just, sort of this issue: how should we be dealing with e-cigarettes? Because as the treaty was negotiated, they're not included. And so it was put on the responsibility of the framework, the parties to meet back at COP5 with sort of a report on the state of policy globally and recommendations for the organization. The information that came in between the parties was, I've been told that the report was not fully accurate in terms of it being complete. It stated that 13 parties of the convention, most of the world has signed on to the FCTC. There's 179 parties. The US is not a signatory, or they may be a signatory, but they haven't ratified. At that time, there were 4 countries that said that they had legislation on the books that had effectively banned e-cigarettes, and other countries, 8, that had put restrictions in place that limited some aspects of the marketing in terms of health claims and whether or not there was nicotine. So the recommendations that came from COP5 were for the member parties to, at a minimum, monitor what's going on in your current country in terms of sales, what's going on with respect to who's using ENDS or e-cigarettes. And then there was similarly recommendations that there should be a regulatory approval process for any ENDS product. There should be considerations for restrictions on when and where people can use it, and encourage member parties to consider taxation and other issues. But the statement that sort of comes out from the Tobacco-Free Initiative is that they discourage citizens from using e-cigarettes as of last year. Again, turning to sort of NGO community, who's making some of these statements. The union has put out similar positioning. They are recommending that e-cigarettes be classified as medicines and then regulated appropriately in that way. The Non-Smokers' Rights Association in Canada has clearly stated we should not be banning e-cigarettes, and they have put forward recommendations that similarly we put product regulation restrictions in place around safety issues with the e-juice that they call it. So if you look globally, again, then sort of just quickly to summarize what the landscape looks like, there's a handful of countries like Singapore that have banned the use of e-cigarettes in their jurisdiction. And the way that Singapore achieved this is that they have an aspect of their legislation that bans any confectionery or other food product or toy or other article that is designed to resemble a tobacco product. So as we get e-cigarettes that look less and less like cigarettes, I don't know how well that will stand up. And then there's a whole bunch of countries like Norway that sort of have these restrictions in place. Norway in '89 decided no more tobacco products in their jurisdiction. And that's the legislation that they're using, classifying e-cigarettes as a tobacco product, and then putting forward similar restrictions that if you want to enter the marketplace, you have to sort of accomplish and achieve these pieces of evidence that has to clearly be reduced harm, but there's not a lot of clarification on what those evidence need to look like. New Zealand, again, has restricted, I think you can purchase the apparatus, but you cannot purchase products that have nicotine. They cannot be making medical claims. So it's, and you can't sell it to anyone under 18 years of age. I wanted to highlight Canada, it's my people, but also sort of just knowing the hypocrisy that sort of exists. Canada is similar to New Zealand in that you can't legally buy an e-cigarette that has nicotine. And it's very clear if you look up on the Health Canada website that there's been no market authorization for any product. And in addition, if it were to make medical claims, it has to go through this process. Parliament buildings in Ottawa, if you walk 5 minutes south, the largest e-cigarette chain is right there, and they sell nicotine, and they have at least 16 stores in Ontario alone. And it's really funny because on the Health Canada website it says persons who may be importing, advertising, or selling electronic smoking products without the appropriate authorization are asked to stop doing so immediately. Or we'll ask you to stop again. So there is some action happening right now around provinces and other jurisdictions to go through. The UK has, and David talked about this a little bit too, is again classified them as medicines, which means I think that once there's some product that goes through and achieves the validation and accreditation, you can write a prescription and their national health plan will cover your e-cigarette eventually. Not as yet. The European Union has made decisions recently too, just this winter, and things will come into effect over the next 18 months, I think. But they are primarily setting standards to standardize products across the union. That's one of their objectives. E-cigarettes in the marketplace will be disposable or refillable, and they've set product restrictions in terms of the concentration of nicotine. It's, I think, 20 milligrams per milliliter of solution. But their regulations really feel more like standardizing the products, have to ensure that they deliver consistently. And I think it's really interesting that I guess there's been a lot of media backlash with the European Union that they actually have a Mythbuster. That's what they call it. They have a PDF on the European Commission's website, Mythbuster, e-cigarettes. And it goes through because I guess the way things were being framed in the media was that they were banning e-cigarettes, and they're not. So that's a really quick sort of tour through the world on sort of regulatory approaches that we can take and some examples of what is going on. So, like time for a couple questions, or Deborah?
Very recently, I think it was CVS said that they were no longer going to sell combustible tobacco.
Right.
And they were really held out as a model, hoping now that the pressure will now be on other drug stores. Mm-hmm. And you made a point about accessibility and restricting sales to places where people over 18
right.
have access. What impact might the CVS move make, and how do you think that will roll out for for e-cigarettes? And mm-hmm. is CVS going to sell e-cigarettes?
Yeah, CVS has said they're not going to sell e-cigarettes similarly to tobacco until there is evidence. I mean, what's happening in the retail environment right now for e-cigarettes is just astonishing. They're everywhere. They're in gas stations. They're in convenience stores. They're in grocery stores. They're in standalone bricks and kiosks or a storefront, right? So I know when I worked on a local ordinance in Massachusetts when I lived there to get the community to pass an ordinance to require all pharmacies to not sell tobacco products, and it was successful. And the argument was, well, you're just going to displace it, and people will just walk into grocery stores or the liquor store and things like that. I think we're very quickly going to see more and more studies that are sort of going to push us in one direction or the other in terms of the efficaciousness of these products to actually accomplish some of the harm reduction that they can. And one of the points that the Non-Smokers' Rights Association in Canada have in their position statement, and the union as well, is that we need to constantly revisit this. The union has set a timeline right in their position statement that they will revisit it within a year. And the Non-Smokers' Rights Association in Canada said, if we find that these are good products or that we can balance some of this risk, then we need to remove the barriers to when and how and where people purchase them. So I think things are, it's more, I wonder to what extent, specific brands are going to emerge and how they're going to maybe be associated with certain retail environments and how the ubiquity of them. There's work at the American Legacy Foundation at the retail in sort of different parts of the U.S. and I guess in some parts, there's just so many different brands. There's, 250 is the number they sort of fancy about. And in a place like West Virginia, where you'd think, like, who's having the time to figure out how to differentiate the retail market there? It's just so different, right? So it's not a big state. It's not a populous state. So
one last thing, let me just ask, do you think, how long will it take for e-cigarette Lucy's to be sold on the street in East Baltimore?
Oh, e-cigarette Lucy's. I don't know what that means.
Because you're from Canada.
Oh, Lucy. Oh, a single. Yeah, you can buy them.
You can buy a single. That's just that they cost $7 or $8. And
Yeah.
they say they last as much as a pack of cigarettes. So, but you're paying $7 or $8, which some kids can't afford. But
Yeah.
of course they're going to get them.
Yeah.
How to get them.
It's, yeah, I don't know if it's on the street, but you can certainly go into certain shops and buy a Lucy. Lucy, got some slaying to do. That's my generation. David?
A sort of comment question. What troubles me is as we're collecting the data, and we're knee-jerking with perhaps some good restrictions and policies and perhaps some ones that are overly panicked and overly restrictive, and maybe some others that are less restrictive than they should be, we end up in a sort of feedback loop where the data, it's almost like what I said, there's a self-fulfilling prophecy that if you overly restrict them, if you make the nicotine levels so low that it doesn't work at all, you're going to encourage dual use and them not being useful for quitting, and then you're going to say 2 years from now, look, they don't work. Let's keep the restrictions or make them even worse. So it's a bit of a catch-22. Which way do you go? Do you first say, let's tell the public they're safer and that they can help some people quit, although the data is very preliminary, or you say, there's not enough data, we don't know, they may not. Because those two statements are very different for changing population-level patterns of use.
Mm-hmm. I think we're coordinated in the community, and there's a bit of a natural experimentation going on. So it's sort of our responsibility to see, well, what did happen in the EU when they set a concentration, and if a different jurisdiction doesn't, like, we can look into those natural experiments and hopefully develop better policy, and quickly.
So one more question. Do you want to call on someone?
Oh, sure. Thanks.
I just had a follow-on. I think there's a third option. It's not just either or on the dosage. I'm used to speaking loud enough. I don't need this, but you could brand it for dose dependent, and you could have the red dosing and the minimal dosing to further behavior change for individuals who look at it as a medicinal, a therapeutic intervention versus using this product. And perhaps we need to expand our marketing strategies to include both, because those are separate marketing populations.
And it's very similar to what the tobacco industry does now. The concern and what we have to mitigate is that the different levels might work really well to initiate as well, too, as opposed to just to help people cessate. So we have to, we don't know necessarily. And I don't know to what extent people can control the dose regardless. I guess you could know based on your smoking behavior. So if you have a high concentration and we decide let's make it high so it's good for people that are trying to quit because it's going to be satisfying, and also making it high might make it less likely that kids are going to initiate because it's going to be, like David Letterman was saying, like I'll get dizzy and throw up, which is what kids used to do when they puffed on their first puff of a cigarette, because they had to learn, they had to learn how to sort of dose themselves with the drug. So it's if we do a medicinal route, if it's sort of treated as this is an effective treatment and that's sort of the path, I think that's a totally logical way to help people reduce their dose with the end goal of cessation. So, thanks.